Over the past year, an increasing proportion of mental health and counseling services have been offered at a distance over video conferencing or, in some cases, telephone. Now, I can tell you, a lot of providers had their doubts about this. It's too impersonal. We won't be able to get that same sense of connection with our clients. Our impact will be less, and so on. And some of that has turned out to be justified. But one of the surprises that I hear from more and more providers is how much their clients have liked these sessions and, in fact, prefer them to in-person meetings. Now, most of us have had at least some people say, when everything gets back to normal, can we keep meeting this way? And there's a couple of reasons for that. One of the biggest is that it's more convenient. If you've got a therapy session across town, you have to get organized, you have to drive or transit over there, leave enough time in case there's a traffic problem, find parking, pay for parking, and usually the parking fee isn't reimbursable, even if the therapy session is. Then make your way up to the office, hang out doing, nothing except reading old magazines until your session starts. Then you have your session, and then you have to do most of that in reverse in order to get back home. Now, a lot of my clients, it's an hour to get here. They're here for an hour, and then it's an hour to get home. That's half a day. I've had clients actually fly in to Vancouver and stay overnight so that they can get therapy sessions here. This is hugely inconvenient and hugely expensive. But virtual sessions, you get to be at home, where maybe you're comfortable, and if it's a hard session, you don't have to kind of pull yourself together at the end in order to be able to drive somewhere. All that said, there can be some downsides too. So what are some tips for making the most of your virtual therapy? First, get a headset. Regular earphones are fine too, and if they have a good microphone, so much the better. You want decent sound in both directions. It does not help your therapy if your therapist can't actually hear you or if you are straining to hear them. As well, a headset gives you a bit more privacy, especially if you live with other people. If your kid is right outside the door, you can always lean in and whisper into your microphone, but your therapist does not know that there's someone right outside the door who can hear, so your therapist isn't going to whisper. If you're not wearing earphones of some kind, their voice is going to come straight through the speakers. So you're saying your sex life with your husband isn't satisfying. Do you really want that echoing through the walls? Next. Well, more of the same, really. Get some space to yourself, a private room where you will not be interrupted. Now, this is not a time for open concept living. You don't want to be looking over your shoulder and discover your kid has been with you the entire time. Now, the best is a room that's carpeted, because the carpeting absorbs a lot of the sound. That's why your therapist's office is almost certainly carpeted. It makes the sound dampening a little bit easier. And you can have a towel that you put across the crack at the bottom of the door. That's where a lot of that sound gets through. Now, if you really want to do a good job, you can put weather stripping around that room's door so that it's even more sound dampening. Soundproof, not really possible, but sound dampened, that you can do. Now, with remote therapy, you're home. So it's tempting to think, I can multitask a little bit. Maybe you can put something in the oven, or deal with the kids, or put the dog out, or take deliveries or whatever. Every single one of those things is going to make the therapy less useful for you. Do what you can to take that hour just for you. The kids can wait. The dog can wait. Everything is on hold. This is just for you. None of that stuff would get done if you were in your therapist's office anyway. Try to arrange it so you don't have to do it during your at-home session. Now, I've had a couple of sessions with clients where I felt like we were trying to really trying to work around the edges of the person's attention. The kids were asking for stuff, the doorbell was ringing, people kept coming by and seeing what my client was doing. Therapy doesn't look like much. It's two people sitting in chairs, but it's hard work. You need your whole mental desktop in order to do it. So clear the decks. You don't really get that much time in your life to focus and work on yourself with your therapist. Let's make the most of it. Now, you can do video therapy on anything, your computer, a tablet, your phone, whatever, but it isn't the same as in person. Looking at a 4-inch screen on your telephone is especially distanced and remote. If possible, do not use your phone. Use the biggest screen thing you've got and position it well. Normally your computer is down on the table so that you can type. But the result is you're usually hunched over, you know what this feels like, looking down into the thing. You will feel better if you can sit upright with full, good posture. Get a box, even a cereal box, something like that, and boost your computer up a bit. Now the ideal is to be looking straight ahead, not down. Now, you'll probably also find that you'll be more alert if you're sitting up, not slouched around on the couch. Now, your therapist has also set up their therapy room especially for you. They've made it the right temperature. They've tilted the blinds if there's someone outside the window who could see you. Their office typically is not a distracting mess, and maybe they got you some tea or water. And before every single person comes into that office, they look around to see if there's tissue nearby, just in case. With remote therapy, your therapist can't do that. It's your room, so it's your job. You don't want to be racing off to the bathroom to try and find tissue if you need it, or off to the kitchen to get some water. Get yourself set up in that room. Tissue, water, maybe some tea, a nice temperature. And if there's neighbors right outside the window, position yourself so that they're not staring at you your whole session. Now, one of the downsides of remote therapy for a lot of people is that home is really no sanctuary. People don't respect your space, or it's chaotic, or the kids always want something, or a relative always has the television blaring. You may need to improvise. We therapists have all seen people who are camped out in their bathroom, or in the basement, or on the deck, or in their garage, or in the car. Don't be driving, obviously. Now, some people even find a bench in a park somewhere. That's maybe not ideal because other people can come by, but it may be your best option. Now, think also about the time of your appointments. For in-person appointments, maybe you schedule it around traffic or something. For at-home appointments, you can schedule it for when you have childcare or when no one is going to be in the home. The kids are at school, or your roommate or partner is at work or out at their soccer game or something. That's what you want. Next, prepare yourself for therapy. For in-person appointments, you get the time to walk over there and maybe sit in the waiting room to settle down and think for a bit. What do I actually want to talk about today? Where are we going in this therapy? How has my week gone? And then when you go into the office with your therapist, you're in this kind of different space where you're ready for it. For remote therapy, you don't have to go anywhere. The computer's right there, so at 10 seconds before 2 o'clock, you can race in and turn the damn thing on. Well, don't do that. Take a little time before your session and sit and think. What are you doing? What's your agenda? How are you? What do you want to say? Are there things you want to make sure happen in this therapy session? What do you want to get out of this? How did the things that you planned to do this past week, how'd they go for you? Start the therapy, in other words, before your therapist even gets there. You can sit quietly or look at your notes or meditate, or maybe the best thing is to take a walk around the block. I do training programs for therapists setting up their practices, and I'll let you in on a secret that I tell them. The waiting room is the therapy. It is designed to be a quiet, non-distracting space where you can collect your thoughts, or your clients can. That's why we don't have televisions in there. That's why the news channel on the radio is not playing in your therapist's waiting room. The magazines aren't actually all that interesting. They're not supposed to be. What the waiting room is for is that space for you to adjust to the idea of coming into a therapy session. Now, similarly, when your session is over, don't close the computer and then race off to whatever's next. Normally, you'd have the drive home or the bus ride to sit and think about what just happened. So do that. Take a bit of time when your therapy session is over. Think about your reaction to the session. Look at the plans that you've made for the coming week. And maybe you could even get started on any home practice that came up during your hour. So those are a few ideas to help make the most of your virtual therapy. It can be just as helpful as face-to-face sessions. But those sessions are carefully arranged and stage managed by your therapist. In virtual therapy, you need to take on that role. And if you do, you'll find that your sessions can help a lot more. What are some of your ideas about how to make the most of online therapy? Add your comments below. But remember that if your username is your real name, that will be public on top of your comment. So I don't want anyone violating their own privacy.